Hi, I'm Lisa Haupert, and I'm here making my third video for you, having had a belt lipectomy, or a lower body lift. And I had that 3 days ago, 72 hours actually, 72 hours post-op. So probably the best thing is for you to go back and watch my first and second videos where I talked to you about the decision-making process for having this rather massive surgery. And tell you a little bit about my history. But just very briefly, I lost 115 pounds through diet and exercise. I'm 55 years old, and over a year and a half ago, I had an upper body lift where they did a breast lift and an arm lift. Got rid of what I sometimes call my bat wings. And after some serious contemplation to have this very big surgery, to have my excess skin around my midline removed, I decided to do it and had it done exactly 72 hours ago. So just a little bit about that. I woke up in the recovery room and was not in a lot of discomfort or pain. Um, the surgeon that I work with, the surgeon that did the surgery on me, actually uses an epidural for pain management. And probably the best thing for you to do to understand that is to go online and read some about it. But there's a small needle that goes into the epidural space near the spinal column, infuses some numbing medicine as well as some pain medication. And in these days, they can really target the area that they numb. So they were able to make the area right below my rib cage to right above my pubic bone numb. So when I woke up, I wasn't in a lot of pain. I was in a semi-sitting position with my knees elevated so that the incisions would not stretch too much. And I got taken back to my room in the hospital. This particular surgeon keeps you in the hospital for 2 nights after doing a belt lipectomy or a lower body lift. There's actually some surgeons who send you home that very day. And in my humble opinion, and I am a nurse, I think that's a really bad idea. It's a massive surgery. There's a lot of trauma to the tissues, and actually there's one YouTube video I saw of a surgeon actually doing it, and if you watch that, you can see the severe trauma to the tissues. So I think what I want to do right now is show you the incision, show you the drains, and I want to apologize up front. I do still have anesthesia brain, and if you've never had massive anesthesia, you are just still not quite right for a little while afterwards. So if I repeat words and phrases and things don't come, that's most likely why. At least that's my excuse. So let me show you my incisions and what's going on. I have not ever heard of anyone having this surgery without having drains to drain out the fluid that accumulates under the skin. And so we'll start with that. I actually have 2 drains, and I've heard of people having anywhere from 2 to 5 or maybe even 6, but this surgeon used 2. With this surgery, they cut around your entire lower body. So the incision goes from above the pubic bone up over the hips and up over the butt cheeks and essentially meets in the back above the butt crack. Okay, so the incision, so what they do is they make this incision over the pubic area and up over the hips. Then pre-surgery, they pretty well decide how much skin they're going to take out. So in my case, if you watch video number 2, you'll see it. The markings, they removed about 8 inches in the highest part, excised the belly button before that, and stuffed the belly button itself back in and pull it through later. And then cut off that skin and attached adipose tissue about 8 inches worth in the front. Pull it down. In the back, the incision goes up over my butt cheeks, and so then they cut off, I think I saw about a max of 8 inches there, and pull my butt and thighs up on the side. So it's massive trauma to the body. There's huge fluid shifts that occur when this happens in the body. And so for a while the body doesn't get rid of all the fluids, and then it does, and it can cause your vessels to fill with a lot of fluid, as it should. But this is one of the reasons I think it's really important to at least stay overnight in the hospital to be monitored. But there's lots of people and surgeons that would disagree with me on that. But in my conservative nature, that's what I think, and from my experience as a nurse. So I guess I'll quit preaching about that. So after all these surgeries, it's best I can tell people wear a compression garment. And the one I had immediately after surgery is a little different than the one I have on now. Today I got to shower, so I got to change and put a new one on. This is just a Spanx garment. The other one I had on was probably a little more compressive, but this is still pretty darn good, and the surgeon said it was fine. What you see here are my two drains, and I've just got them safety pinned to that Spanx garment I'm wearing. These drains are suction. They're vacuum. I unclip it, it expands, I close it, and it creates suction. And it pulls out fluid. One of them, this tubing, you see these tubings, actually, and I'll show you the place, insert through the skin here, and one of them, the tubing will go around towards the front underneath the wound, and the other one, the tubing goes around the backside underneath the wound to help drain out accumulating fluid. This is about as much fluid as has been in there. This is probably 4 hours worth of fluid today, but I must say the first 48 hours there was lots more fluid than that in there, and you certainly wouldn't want that accumulating under your skin. My belly is swollen. You will see that. And if you don't want to see this, just look away for now, and I'll sit back down and talk to you some more in a little bit. So this is my compression garment that I have on. The first thing I'm going to do is show you the incision that's in the front. I'm going to start with my belly button. They actually cut out the belly button, stuff it in the abdominal cavity, and once they've pulled this skin down to meet at the pubic bone, they make a new hole and sew the belly button back in. So here's my belly button, my new belly button. And you'll see some blood. That's just, he uses some glue at the incision, and that's just glue, blood under the glue. So that's my new belly button. These red lines here are just from the tubing, from the drains coming out, and I probably need to put a gauze there so that doesn't happen. The incision comes up over the hips on the side, and so let me show you that. So that's the incision on the side, okay? And it goes down in the front to the pubic bone, okay? Just like that on both sides, okay? There's glue on top of this incision, so again you're seeing old blood under the glue. You can see the swelling here. This will all be flat and actually quite concave. And you see a lot of bruising, which is not uncommon, I understand. And in the back is the rest of the incision. So that's what that looks like. And then this is a little more graphic because it's the drains, but I think it's probably worth you seeing, and it seemed to have a little bit of drainage here. This is where the drains insert. Right there. And that's just one of the insertion sites, and there's actually two of them. And I will cover that up and deal with that little bit of drainage later. So that's what you can see right now. And before I sit down, I'll show you. Right now, as you can see, I'm standing up fairly straight. I don't know if you can. Fairly straight, but certainly the first couple of days and even earlier today, I had to walk a lot more hunched over. So that's what you see. And I think what else I'm going to tell you today, and then I'll tell you some more tomorrow, is just the importance of some things you can do post-op, whether you stay in the hospital or not, to help you heal and to help keep yourself out of any trouble. The major risk of any surgery are bleeding, infection, blood clots, and then lung congestion from the anesthesia. And so there's a few things that we really can't do that much about as the patient. Infection, if it happens during the surgery, there's nothing we can do. But after surgery, it's really important to use good hand washing. Anytime you're going to get close to the wound or have anyone help you, make sure they've washed their hands really, really well. Okay. The other thing you can do is to walk as soon as is reasonable and possible after the surgery. My surgeon insists that the night after surgery, the nurses help you walk. The quicker you get moving, the better for your lungs and the less likely you are to get blood clots. The other thing you can do, even if your surgeon doesn't order it, is to get some Compression stockings, just the white compression stockings up to your knees to help with the venous blood return. Again, during surgery, your legs are stiller than they normally are. After surgery, you're not walking as much, and there's increased risk for blood clots. And the other thing that you can do that's really important is deep breathing. Now, coughing after any abdominal surgery is not fun, but you've got to do it. You just put a pillow against your belly, bend over, hold onto that pillow, and take in a big old deep breath and cough to help clear any phlegm. Again, when you undergo surgery, when you have a tube down your throat to help you breathe, you're not moving as much, it's easy for you to get fluid accumulations in your lungs. So those are some really important things that you can do and that are really easy to help you. And I also want to talk to you a little bit about pain management. My surgeon used an epidural. I understand that very few surgeons do that. Most surgeons are probably just going to use oral pain medicine, and today a lot of them are just sending you home without letting you stay in the hospital overnight. For me, I had very little pain, but of course I had the epidural. But I think it's important to be comfortable enough so that you can get out of bed and so that you can walk to help prevent these other complications. So pain control is a real important goal. That doesn't necessarily mean you're going to be pain-free, but what doesn't mean you're going to be pain-free. But enough that you can get up and that it's okay for you. So I think that's all I'm going to tell you tonight. I definitely have anesthesia brain. Tomorrow I go back to the surgeon. He's going to consider pulling one of these drains. The one in the front tends to drain less. There's less trauma to the tissues than there is to the back. And I'll talk with you a little more tomorrow. Also know that what you're seeing here with me, I think 72 hours post-op, is somewhat atypical. I recover and did from my last surgery as well more speedily than my surgeons have seen other people recover. And I have a higher pain tolerance than most people do. So if you've had this surgery or going through it and it doesn't quite look like this for you, that's fine. Don't worry. Don't worry about that. The big things that you want to take care of is making sure the drainage is appropriate, making sure that you use good hand washing, deep breathing, getting moving, maybe wearing the compression socks on your feet, flexing your toes and stuff while you're laying down. And I will talk to you again tomorrow and give you some more details. Also know that I'm a weight loss and wellness coach, and you can find my website over at onceandforeverwellness.com. And I'll talk to you tomorrow. Thank you. Bye-bye.